Okay, so today we're taking out tooth number 17 here and 32 right here. Now they're both impacted and they're tilted horizontally. 17 is a little more tilted, and as you can see how it's sitting way below tooth number 18. 32 is not as tilted, but it's still sitting really low. I always start by making sure a patient is numb. When I touch here, honey, does anything feel sharp? It doesn't. How about here? Alright, so just like always, I start flapping. So that's tooth number 17, 18, 19. I start here at the line angle. And an envelope flap all the way through. I go around the tooth. And a hockey stick incision right on the bone. And then I connect the two incisions together like so. You want to keep it on the bone because their muscle attachments a little further lingual here. Again, I'll just go over it one more time. There you go. Periosteal. Now turn towards me. Perfect. It all starts with a great flap. I'm pushing right on the bone here. There you go. Once I have it fully exposed, okay, let me have the Minnesota. There you go. So that's all the tooth exposed. I can see the bone. Okay. So then we start the troughing. Any discomfort? You doing okay? Very good. Go mesially, sweetheart. So I'm troughing, just like always. You want your trough to be very narrow, but deep. I go a little distally, but I don't cross halfway of the tooth. All these noises you hear are normal. Suction in there. So if I'm troughing and a patient feels pain, I just put the anesthetic right in there in my trough. It's like right on top of the nerve, and I let it sit for a second. Don't swallow anything, honey. So I'm going to section the tooth. So I start right here in the midline. Much better, huh? Mm-hmm. So we have the trough. I have sectioned the tooth. Now I'm going to try to split it. You're going to hear a cracking sound, okay? Section there. With lots of pressure now, okay? No, you got to hold steady, honey. Okay, don't be so scared. We'll stop if something bothers you, okay? Keep suctioning. So this is the crown portion of the tooth that came off. Now we have the roots in there. Okay, come out, honey. Suction in there.
You're doing very good. Don't worry. It's just pressure. It's just pressure, okay? You're doing super good.
Stay right there. Turn towards me. Turn towards me. Now hold it right there. Don't suction it. Suction it. Now look at the curvature on the root here. This is why it wasn't coming out. So now it's out. Irrigation, please. Done with that one. That one is the hard one. You see my flap here? Turn towards me. My flap just falls very nicely on itself. I know she will heal very nicely. All I have to do is put a suture here and close it there. I will grab a big bite and then just bring it over. Stay right there, Ileana. Okay. Good. You see how I closed it? It lays on itself and it's completely closed. So 30, 31, 32. I start on 30. Okay, so I continue the flap and then I do a little hockey stick here. I'm hoping this one comes out easier than the other side because it's not near the section here, honey. Stay on top of the suctioning for me. Periosteum. Okay, I raise the flap. So I'll make sure I separate the periosteum. Okay, I'm going to join my incisions together here. Okay, so we're troughing again. So I go mesially, buccally. I always stop after a while. I look at it, I have the assistant suction. Alright, now I can see I troughed it mesially, buccally, and distally. So now I'm going to try to elevate it and hope that it comes out. I'm seeing some mobility. That's a great sign. Lots of pressure. Now I've found over the years it's better to elevate in different directions. So I do a little on the buccal, but not too much because I don't want to break the buccal plate. Nice and gentle. And then I go back to mesial again. Now let me have the other elevator, honey. Now I switch to a larger elevator. Give me more full power. There you go. And that is it. Let me see. Just like always, I look at it. You see the curvature? That's what caused the trouble. Now it's out already. Always irrigate after troughing. Keep it nice and clean. Touch it in there. Again, I look in there, nothing is there. Perfect. Now I lay my flap back where it was. See how it lays on itself nice? Just one suture here and we are done. Big bites. Okay. See, nice and closed.